and for this interesting discussion. So just to give I don't want to get, you can read my bio online whenever you would like, but I'd like to welcome everybody firstly, and also the panelists today. I think it's going to be an interesting discussion around a case study in Ethiopia and ARC's enablement work. I just want to give you a very quick sort of introduction of who ARC is, Africa Resource Center. For those of you that don't know it, it's a continent-wide public health supply chain strengthening institution that enables and advises partners like donors, BMGF and others, but also Ministry of Health and private sector across many African countries. West Africa, our co-CEO is actually Mr. Dr. Ibnu, is here from Senegal. And we cover most of the African countries from a supply chain perspective, where we enable developing innovative solutions that can engage efficiency and transform supply chain for public health outcomes and priorities. So today specifically, as you know, 1.3 billion people in Africa, and it's interesting to see that nearly half still do not access their essential health medicines. It could be a problem of access, geographic access. It could be a problem of affordability. And how could we solve that with so many institutions and funding going into the continent? How can we transform and ensure every last mile access to essential medicines that's affordable and of quality to the people? So we thought, especially for the continent, as you know, private sector plays a significant role, and especially when you talk around logistics, access to medicines, but essential commodities such as toothpaste or any other that you think private sector plays a significant role. How does private sector ensure we have a Coca-Cola bottle in every little store in Africa, right? And what about medicines? So one of the ARC's case study here, and it's really interesting to see the perspective, would be really looking at private sector logistics, fleet management, and ensuring that is there a way that we can leverage on private sector efficiency to increase access and availability, right, to the population? So it's a pleasure to listen to the outsourcing toolkit that's been developed and enabled by ARC in Ethiopia, and also with its main client, Ministry of Health and EPSS. Dr. Abdulkadir is the Director General of the Ethiopian Pharmaceutical Supply Service Agency in Ethiopia, and we'll speak about implementation of this outsourcing toolkit and how it's been developed and what are some of the lessons learned moving forward. Okay, so firstly, I'd like to invite then our ARC country lead, Mr. Alemayehu Wolde, who's Ethiopia ARC's country lead, and who will be speaking. He's been serving the Ministry of Health in Ethiopia for over 15 years as a pharmacist at a health center, hospital, Regional Health Bureau, and he's been head of the Pharmaceutical Services and Logistics Department. He's led donor-funded procurement, storage, and distribution of pharmaceuticals and medical equipment according to different donors' guidelines. He participated in the Health Sector Development Program, focusing on pharmaceutical reform and medical equipment management strategy. And furthermore, he's worked in Namibia for 10 years as a senior supply chain management advisor, and for 1.5 years in Eswatini as a supply chain. So amazing experience and expertise that he brings on board, and specifically as to this case study around the outsourcing toolkit that's he's been able to develop in conjunction, in partnership for EPSS and Ministry of Health, as well as Village Reach, who's an implementing partner in this initiative in Ethiopia. So without further ado, if I can give you voice, Mr. Alemayehu Wolde, to give us an overview, and I will introduce the rest of the panelists thereafter. Thank you so much.
Thank you, Maraki, and thank you all the audience. My name is Alemayehu Wolde. I started working for ARC 2 years ago. 3 years ago in 2021, I really appreciate this arrangement by ARC to share our process. Actually, this is not the final. The final is after the implementation, but the whole process. And we want to share our experience, lesson learned, and also the way forward. Next, please, the slide.
Okay, so you would like to start with the presentation before introducing the rest? Okay.
Yes. This is about 6 or 7 slides, but I might take 15 minutes to take you through how it started. I think you can click first. I would like to introduce what is OSTK and how does it start. The project that we are doing here is Ethiopian project, but the OSTK, what we call it, outsourcing toolkit, is available online. You may click it. It is actually, this toolkit is developed by ARC and its partners, but it is actually the toolkit and an owner is USAID, who supported this project. Then can you click on this www.ostk.com so that it can take us to the website. So everybody who is attending this, you can use this www.ostkonline.com to access actually the actual toolkit that we are using to implement the outsourcing process. Double click.
Okay, so I have shared the link into the...
Yes, this is actually the OSTK toolkit that we are implementing following to outsource the transportation in Ethiopia. This toolkit is USAID supported toolkit developed by ARC, Global ARC, actually supported also by different partners during the development. This toolkit has actually 3 basic parts. Keep it as a top. Keep it as a top. Go back up. The assess phase, the evaluate phase, contracting phase, and implementing phase as a top. If you see in the process step, it gives 4 parts. These parts are, first, the assessment part is the situation analysis part, which started in 2021, supported by ARC, and come up with a big report of the situation analysis. And we followed the assess part. And if you click on the assess part, it gives you the whole process that you have to follow to do the situation analysis. Then produce report. That part, actually, after producing the report, we went through a number of persuasive approach for the policymakers, the management, and all others, that the current situation that we have analyzed is a very expensive and efficient process. So we proposed the proposal how to outsource it, outsourcing options. Then we went through the board and we get approval. Then we went to, in 2022, we did also market analysis. Market analysis, the evaluate phase. Then in this market analysis, actually we did the business case as well. And this, when you click it, actually it gives you the whole process that you have to follow to evaluate the private market. Then currently, we are on the contract phase. You can return back to the slide. You can return back to the slide. Next. in this case, we did the startup. We got the policy directions from the organization, the government of Ethiopia signed the engagement of the private sector. Significantly, they just saw the problem. Then we started this PPP approach for distribution and fleet management directorate. Click it again. Then again, these are the 4 steps that we actually discuss. This is assessment phase, is the phase that we did it with EPSS, ARC, and Global Health Supply Chain Management as a partner working with us in terms of assigning a local technical advisor in the assessment. From EPSS, every time we use the technical working group. In each step, different technical working group. Up to now, we are actually forming a technical working group, the 3rd technical working group, to follow locally and support the technical advisors in processing, in going through the processes. So the initial phase was assessment. The second phase was physical feasibility study, which is the market analysis on the willingness. So willingness and capacity of the private sector to actually contract out EPSS transportation service. Then after that, we discussed with a number of government officials like Ministry of Health, Board of Directors, management, and finally we got a go-ahead. It is a very, very persuasive stage from the government. You can return back, please. Then what we did was actually we did a number of meetings and convincing of the board of director, and the board of director, technical working group of board of director gave us directions, and they gave us to do it phase by phase, and then continue for contracting phase. And we saw that the contracting phase and the implementation phase is interlinked. Because of that, we started it together. Next slide, please. In the contracting phase, what we did was actually, we found that Village Reach has an experience. So ARC actually contacted Village Reach, and we signed memorandum of understanding with Village Reach. And then up to now, we are working with Village Reach on the contracting phase and implementation phase. Next slide. The team, we have established the team again in the contracting phase. The team is led by the Deputy Director of EPSS on the outbound side. Then click, please. We also did a series of activities are carried out to finalize RFP, request for proposal, and service level agreement. Drafting of SOPs and transportation management strategy is also underway. We started tendering. The tendering process is underway. We already put it in the EGP, Electronic Government Procurement platform. There are processes actually to be followed on the EGP. Currently, it is on the EGP. Next slide. On the next slide, I would like to show you the next actions that we are going to do. This is, we are on the finalization of the tender process to select the qualified vendor. We are trying to, we already planned how to expedite evaluation process. There will be a pre-bid conference, consultative workshops, with workshops with both internal and external stakeholders. There will be expediting the evaluation process, and we will start the implementation of this outsourcing for the year 2017 Ethiopian fiscal year. In this process, in the last 3 years process, what are actually the impacts of this process? It is still a process, but what we have seen is actually it has an impact on the environment. First, we have gotten a buy-in. Obtaining a buy-in is, it was really the difficult task, but because of the commitment from the EPSS management, actually we got the buy-in. There was a brokering, there was a persuasion discussions, consensus, management and the board consensus on the outsourcing of the transports. This is also a success that we gain. It's an impact of the work, the assessment and the evaluation. Interest also, the interest of the executive committee and management to use the OSTK tool to other outsourcing activities. This was gained because it is not only transportation, but currently the management is interested also to use OSTK for other non-value adding activities. So this is also the result of this process. OSTK is actually impacting a commitment, EPSS commitment, including allocation of resource. We started it with the resource allocated from ARC, but when we move from step to step, other partners became, engaged, and they also spend money, as well as the EPSS management actually put money on this activity. Actually, it is not, currently it is not a partner or donor supported activity. It is the biggest cost that is coming from the government. That is actually, we have gained the government acceptance. Acceptance of outsourcing is well, known. On the other hand, this is the first time that OSTK is used for outsourcing service. Then that means the first toolkit is in the process, it is a test. So we have collected actually feedback from the consultants on the application of the toolkit. So actually we are gathering information for the next generation of OSTK. That means this is also a good result for the work that we are doing. There was a capacity building. I told you this capacity building was for the technical working group. The technical working group that we formed locally, they were actually working with the consultants in the assessments. They were working with evaluators in the evaluation phase. Again, currently they are closely working with a consultant and ARC on the contracting and implementation phase. If we look at the next slide, if we look at the lessons learned, it gave us actually the strategic thinking. When I say strategic thinking, we started with EPSS management, the outsourcing, and we have gotten the green light to go ahead, and we are determined actually as EPSS to outsource. What did we learn? Starting from last year, actually, we were investing on the procurement of vehicles. the money gotten from different partners. Since we were determined, starting from the last in 2022, the whole procurement was actually channeled to the regional capacity building. We started thinking, actually EPSS started thinking to build the capacity at the branch hubs rather than at the center. So the type of actually track that procured and actually received this year are actually aimed fit to purpose. And then we are capacitating the hubs rather than the center, because we are aiming to outsource the movement from the center to the hub. So we started actually the strategic thinking of, transport management is actually built. We also focused on the core competence. This is enhancing core competence. So the collaborative work on the organizational transformation is built. We also learned that systemic approach to mitigate risk in each assessment, actually risk identification was the major area. Risks were beforehand identified, and also risk mitigation strategies were kept in both assessments. And currently also in development of the RFP, risks were identified and risk mitigation strategies in service level agreements were installed. So these are the lessons learned from that. Self-reliance to ensure sustainability. This is a very important part. In Ethiopia, the way that we are planning outsourcing strategy is government-owned, and the cost of transportation, the cost of moving product from the center to the hub is going to be covered by the EPSS. It is not partner support or short-term projects implementation. It is completely a long-term, a lifelong strategy. And as far as we evaluate it, we will correct it, and also we will implement it by monitoring it. So once it is triggered, it will continue to happen in EPSS. So self-reliance to ensure sustainability is instilled in the process. This is the presentation that I'm going to present for you. Thank you very much.
Right on time, Alemayehu. Thank you so much for your elaboration. I think there are so many points that you raised that's really of interest here when you're thinking of working with private sector, outsourcing, but especially, and I want to go to Dr. Abdul Gelgelo here, who is the Director General of the Ethiopian Pharmaceutical Supply Service. And just to give a short bio, before assuming his role in August 2020, he was Deputy Bureau Head and Clinical Service Director at the Oromia Regional Health Bureau. And in his capacity, Dr. Gelgelo oversaw clinical services and supply management across the region. He brings over 8 years of extensive experience in public health, clinical practice, and academia to his current role. Dr. Gelgelo is a qualified medical doctor dedicated to advancing healthcare delivery in Ethiopia. And just before I give some reflection opportunity to you, Dr. Abdulkadir, we know Ethiopia, not because I'm Ethiopian, but Ethiopia is extremely complex as a geography, especially when you think of mapping out the supply chain, the risks. Alemayehu identified rightfully, how do you identify the risks? And in order, when you use this outsource toolkit, right? How do you customize to your sort of specific risks and challenges that you have as EPSS? And I would like to hear your thoughts of, how has it been in terms of this toolkit as an enabler and transformation of supply chain as EPSS DG? And has it been, what are some of the, lessons, good lessons learned, and what you'd like to see as in the next steps, especially when you think around the changing dynamics, from central to the hubs. Every region is different in Ethiopia. And so do we contract and outsource to different? And how do you manage that in terms of the specific health products and medicines, right? Does it differ by region and the demand, or is there a way that we can include that? And so just really wanted to hear your reflection around implementation of this toolkit today. Dr. Abdulkadir, please.
Well, thank you very much for the opportunity on really presenting as a panelist about, this logistic issue and the OSTK to the webinar, to most of, I think many of people have been participating from different African countries and so on. Ethiopian Pharmaceutical Supply Service is one of largest public institution, which is really managing the supply chain as a country for more than 5,000 health facilities in the country. And most of those facilities has been relied on this institution for delivery of the product, supply chain, management across to the last mile delivery level. So when you see, we have been some of peculiar nature that we have is we have been supplying the medical equipment, laboratory services, a bulk of it, like the medical supplies, which is a very bulk, compared to many of African central medical store, which focus only on some of the product, and also some are using the privatization for the logistic service and so on. But in our case, as you see, we have been delivering all of this, a product with, huge amount of like $1 billion when we're revolving through the programmatic as well as the essential medicine and so on, which is very huge in the amount, and also the facilities, the nature of the country, the distribution, the geographic and so on has been very different to many of it. So in that case, we have, as the presenter mentioned, one of the decisions that we have made is we have to have an outsourcing strategy for some of logistics and to go exactly manage and make focusing on our core essential activity. Logistic management is very challenging. So rather than focusing more on logistic, we have to somehow source it, the logistic, then focus on the main core activity of the institution. So this is something that we have been around 2.5 years. We have been studying with different partners. Initial assessment has been done. Is it really worth outsourcing? What will be current problem that we have as a logistic? And what will be the benefit if we outsource it? So we've done a lot on that, and we have been some options, which we say, especially we have, central medical store, and there is, subnational stores, then health facilities. So from central to subnational to health facility, we have to make sure that the last mile delivery has to be increased, because currently our last mile delivery for the program medicine, HIV, TB medicine, malaria, so on, which is bulk in nature, as like 60%. So still we have been crossing through some governmental structure like district and so on. So we have to have increased our last mile delivery. To do that, we have to have very robust logistic systems, which we have says we have to outsource some of issues. So this is the issue that we have been, all the process and the phase that we have been passed. What the presenter is presented here is that up to the level of the board, engaging the ministry, engaging different stakeholders. Initially, even USAID has been really supporting us in an assessment through the global health supply chain project and so on. And finally, we reach to this level where OSTK, Outsourcing Toolkit, has been designed this to facilitate the decision-making for the ministry, for the public supply chain organization, not only us. So this, outsourcing is an option to improve the supply chain performance. The toolkits provide structured guidance and resource to streamline the process. This transformation probably, enable us more efficient operation, and the cost, the cost that we have seen in our assessment is very different, because as you have seen, one of the cost center is this maintenance of the truck that we have, the depreciation of the truck that we have, and the system and the efficiency of our taxes, in terms of cost. So we have to reduce the cost and, allow organization to more focus on core function while, leveraging the expertise of third-party providers. Probably I may address your question. I may come back with some of the questions you may have. Thank you.
Thank you, Dr. Abdulkadir. I think very insightful, and I want you to think as I come back after Angelina, around where do you start on the implement? Now I know you're on the contracting, and then where do you start on the implement? Do you start on, because you said EPSS has all of the medical equipments, laboratories, essential medicines, and then how do you link that outsourcing to really getting your priority public health last mile, right? Do you pick on certain medicines first to outsource in certain regions and scale? Or, how do you think on the implementing? Just wanted to hear your thoughts, and I'll come back to you. If I can go to Village Reach, Angelina Cumba, and read and get also your reflections around this, Angelina. Angelina is a supply chain expert with over 20 years of experience in improving logistics, procurement, and inventory management in both public and private sectors. She has a master's in supply chain management. She's known for her strategic skills in boosting operational efficiency. Angelina has led teams that have made big cost savings, which is interesting because private sector inefficiency, and delighted customers in multinational companies. She excels in bringing new ideas, building strong vendor relationships, and promoting sustainability in supply chains across Africa and Asia. And she's always on the lookout for the latest trends. And Angelina, we really want to hear your thoughts around OSTK implementation in partnership with ARC as the chosen sort of MOU and contractor for the outsourcing of OSTK in Ethiopia. Just generally having heard the reflections of Dr. Abdulkadir as well as Alemayehu on the specifics of Ethiopia, and what are some of your current experiences around the contracting? Please think around, of course, cost savings, private sector. When you outsource, there's also efficiency, sustainability. I think Alemayehu pointed to those as well. So if you were to give your reflection around what you see as working very well, significantly in the partnership, but also where can we improve as we move forward with OSTK implementation? Thank you, Angelina.
Thank you very much. And before I answer your question, I just want to say to the people that don't know a lot about Village Reach, we leverage our expertise. We are operating in Africa for 20 years, and we leverage our expertise to collaborate with government and private sector, to co-create solutions that increase equitable access to health products and services. So basically, we want to make sure that everyone have access to essential health service where they need it, when, and where, without incurring financial, hardship. So coming to your question and my reflection on the process of the outsource for EPSS, I think first I want to say congratulations to the EPSS for taking this initiative. Overall, the outsource journey has been progressing very well, with a strong focus on evaluating the current landscape, leveraging local experts, engaging stakeholders, and following now a structured RFP process. So this collaborative and outcome-oriented approach has been very crucial in driving the success of this initiative so far. And ARC and local partners, including EPSS, started this process very well. They shared about evaluating, risk assessment, evaluating the current operation, identify areas suitable for outsourcing. So this first step was very crucial, to allow for a formed decision to make it about the about the scope and approach for the outsourcing of initiatives. So it was very important to start this process with the with a clear assessment, understanding the risk, and also have a plan in terms of how to mitigate this risk. And also the process was also very good because they had to identify a partner. As I said, like I understood that the value of villages brings in expertise into the tools that we are using managing other countries that are going to complement the toolkit that ACI is using. So the decision of collaborating with the Village Reach was very crucial as well. And this partnership has been essential in helping navigating the complexity of the current outsource initiative processes. So this was very good. We did the engagement of the stakeholder, which was very crucial to make sure that everyone understands what is being expected, understand how the toolkit is being used, what are the benefits of using toolkits, really trained everyone, including all the stakeholders, how the toolkit is being used, and also what are the benefits are going to be getting from using this toolkit. And this was followed by a clear, detailed work plan to ensure the alignment and buy-in from all stakeholders. At this moment right now, we are now at the final stage of the RFP process, to select, a suitable outsourced transport supplier. So we are currently carefully considering various important factors. That is also cost, reliability, scalability, to ensure that chosen provider meets the project requirements. So the OSTK is really very important. It's very useful in this process, and it's giving us a well-structured approach to ensure effective outsource operation for EPSS. Over to you.
Thank you so much, Angelina. Absolutely relevant what you're saying, especially the toolkit, giving guidance to everybody and everybody being in the same landscape, or what is it, level of expertise around this is really crucial. I want to come back to Alemayehu around reflections, and all of you actually, before we take some of the questions, but maybe start, I think this one for Angelina's quite interesting for you to reflect upon. And if I can take this question from the audience, and then I'll come back to you, Alemayehu, thinking around how do you see, so again, the same question to Dr. Abdulkadir, which is, okay, implementation phase, how do we think around scalability? How do we think around potentially this OSTK toolkit being used in another setting? What are some of the lessons you've learned from that? And then really thinking, and you've mentioned it, I love that aspect around sustainability, financial sustainability, because African countries and governments, very difficult when it's fully donor supported to make sure that there's sustainability in some of our results and impacts, right? So think around how how do we scale this? How do we package it better to fit other regions, other countries, and what are some of your thoughts? And before I come to you, Alemayehu, there's one question, Angelina. Angelina, how do you feel? So from Jessica Mayenda, Angelina, how do you feel being the only woman on the panel? How's gender distribution in the supply chain sector in general? If you'd like to, respond a little bit to that, and then Alemayehu, I'll come back to you.
Yes, okay, that is a very important. I've been hearing this question several times from different people. Yes, so I think, this is very, very interesting because I view being the only woman on the team as a chance to offer a different viewpoint and share diverse, ideas. And so for EPSS, like, in Ethiopia, I'm having a very good experience. I'm thankful for the friendship and inclusive atmosphere within the team. I've been constantly received, respect, recognition for my work, and the support and actual encouragement I get from EPSS, and all the team from Working Technical Group. So I'm very inspired. And I cannot just say here and say it's easy, in different environment, but for Ethiopia, I'm really grateful. I'm enjoying myself. Sometimes I forgot that I'm a woman, to be honest, because I'm being treated very well and supported. Yeah. And the most important thing, to be honest, I'm gaining a lot of skills. and I'm learning a lot. And the gentlemen, they really appreciate my point of view as a woman. So I'm really grateful for that question.
Awesome. And just to add on that as well, as with specifically Ethiopia, EPSS and ARC, also very supportive as a woman working there. So Alemayehu, if I can give the floor to you. Thank you, Angelina.
Thank you for the previous question, Angelina. Here we have about 10 technical working group. Only Angelina is the only woman working with us as a technical working group, because yes, we need more women in supply chain management. I think we have to work on that area as well. This is we have to change the current situation. Saying that, I will reflect on two issues about OSTK. OSTK is designed for outsourcing. It is not specific for transport. So there are, I hope EPSS will be one of the next, our thinking is next. We have to look at how to identify areas. First, we need to make some assessment to identify areas to go through it using OSTK to outsource. So it is applicable to any outsourcing of non-value, non-core activities, which are actually expensive and also very routine, which doesn't give time for management, which occupies a lot of time for management rather than thinking to the strategic issues. So if others can do it better, actually better to outsource it. This doesn't mean that the public sector is it's going to give all the service to the private sector, but we are thinking that we are going toward, toward efficiency of the public sector as private sector. The thinking is the public sector can function at the private sector. That means the difference is it can be efficient, cost sensitive, fast, to deliver service to the community and to save life and suffering. So the issue is outsourcing toolkit can be used. It is a scalability to other countries. Actually, it doesn't have any nationality. OSTK is global. We can use it we can adjust this according to the context of the country, because the first situation analysis actually gives you what is there in your country or in your organization. Then you think of the environment. First, you assess yourself, then you go out and assess the environment. Then these two assessments will give you the decision-making capacity to say, go ahead. So in any country, first they have to start using OSTK, then you have to go step by step. Then make your own situational analysis. Then after that, assess your environment as well. What does it look like? Even the infrastructure, what does it look like? The market, what does it look like? And compare it also what is existing. Then side by side, you do your business case. Then if it is better than, using the private sector than your own cost, then you decide. So it can be scalable to other countries as well as other organizations in Ethiopia as well. Over to you.
Excellent. Thank you, Alemayehu. Actually, maybe answering one question that's on chat at the same time. Chris Masila from Kenya actually also working in supply chain he was asking, are there, when you assess a certain market in Ethiopia, then Kenya or other, were you using specific tools? I would think there's big categories like stakeholders you'd need to map under each country. Are you using certain standard tools to make those decisions, or how has the feasibility done? He was speaking of what are the key elements reviewed. If you can answer on that, Alemayehu, before I can go.
Yeah. By the way, this question is from Kenya. Our consultant is from Kenya on this issue on the situation and analysis.
Okay.
What we have seen basically is we actually analyzed first, in the first place, the local technical working group we formed before bringing the consultant. We formed the local technical working group, and the local technical working group developed actually the tool. And then based on different sections, actually for this, we would like to thank also Global Health Supply Chain. They hired a local consultant who had an experience. Then we developed the tool. Then when the consultant comes, he came up with his knowledge and technical capacity. And also we went through the OSTK tool before we developed the questions, because the assessment phase actually guides how to actually you frame your questionnaires. What type of issues should be seen, and how can you assess the assessment part? Then the questions were developed from the assess tool, which areas should be covered. Then when we actually go to data collection, we engaged local staff who knows the facility, who knows also the local EPSS transportation system, how we function, and we actually sampled hubs, regional hubs, health facilities, and we discussed all the matters with them with a structured questionnaire and non-structured interviews as well. Both data from the GPS was collected and analyzed. Based on that, we actually saw cost components. We saw the transportation cost, fuel cost, maintenance cost, all the cost categories. Then this gave us actually the comparison, and we come up with 4 options for the government to decide. That means we didn't say outsource it. We said, if you outsource on this way, then this is an advantage, this is a disadvantage. It has this risk, and it has also this advantage and this mitigation strategy. If you use this strategy, we came up with 4 options to the board. The board decided on this, on the current strategy. So the analysis, everything is done, the situation analysis, then the options that we gave them to the management was 4 options. There was a lot of discussions, debates among the management, among the executive committee. I can't say the executive committee, because the executive committee was actually pro the team. Actually, it is a big commitment that we had, but there was a resistance, and you will come up after discussion. So these 4 options are the options which came from the situational analysis. Over to you.
Excellent. Thank you, Alemayehu. Excellent, and a great segue, probably, if I can go back to Dr. Abdulkadir, around, when you implement, then you have those big cost areas, priorities for each country. And there's a question here, if you can also segue to that, because we only have 2 minutes left, is, when you decide to implement based on your priority, where the highest costs are, and you outsource to others, how do you regulate prices, right, for the outsourcing entities? Do you have, like, if there's a private sector or yourself or other, like, how do you make sure that you still stay within affordable costing and it's sustainable to you and you can scale? So if I can give you the last word from you around on implementation and how you see that working and what are some of the things you're thinking of implementing. Thank you.
Well, thank you very much, Dr. Maraki. I think Alex mentioned a lot on that, but I want to say on the scalability within Ethiopian pharmaceutical supply service is, it's multifaceted challenge actually, with require different strategic approach. When we think about this, we have to think about the infrastructure that we have resource, the facility, the many different issues, IT, how to handle it all, even workforce development and so on. That should be clearly considered within the context of the country. That's why in Ethiopia, we are thinking that, we have some experience actually, working with private sector in different sector. So we know that private sector engagement during different time conflict, during many campaigns and so on in private engagement, we have an agreement with them and so on. So we have some, issue which has been initially we have with private sector. So in this case, when we talk about the regulations, the price and so on, which has been, I think, question dropped from one of the colleagues, I think there is different way you can have price strategy for ensuring the price regulation. The competitive bid process is one of the issue which you have, which approach in the contract award, tendering. IPSA, in this case, as you have seen, we have RFP, we have SLA, service level agreement, which can, price guideline and cost ceiling. And there are different methods that we have used with the fixed price contract. Probably some of you a regulatory framework guideline should be developed in such case. But costs is depend on your negotiation with private sector on that, in the way you approach. But there is a book and there is an assessment which has been done by USAID, which has a detail of this. Which option do you use in the price negotiation and so on? I think we have to refer that. It is a very insightful article that we can get from that. We also refer that in a different way. Yeah, thank you.
Thank you, Dr. Abdulkadir. Absolutely. Given time, I just want to, if you can take also the last question, because I think it's relevant to what you just said from Yodit Admasu. She's saying this is a good chance to think about outsourcing in a systematic way. I wonder about the possibility of outsourcing the transportation from the center to the hubs, which I think is something that EPSS can do well, given the big challenge at the last mile. Also, I would like to know if there are any change management tools, since EPSS has so many assets and human resources that rely on their income, right? Especially drivers. And if I'm not wrong, she says there are more than 60 drivers and vehicles. What will happen to the drivers? If you want, Alemayehu, you can give, or Dr. Abdulkadir, if you feel comfortable answering, please.
Yeah, I can answer. Thank you, Yodit, for mentioning this. Sourcing transportation from center to sub-national hub is a strategic move to enhance efficiency. I know people, may think in center, the transformation of, outsourcing, which is a little bit, as not as such difficult to that last mile delivery issues. But in our consideration, we have to start initially from the center. There is bulk movement of the product from the center. There is different, clearance from the custom and different from the port and so on. So when we consider this, the volume of the product that we receive the volume of the product that we push to subnational level is more larger than that from the center, because from the center, from the hub to the facility, a small amount of product can be delivered to the last mile delivery. So we're thinking we do have a lot of drivers, we do have a lot of trucks, which we can push to the facility, to the subnational. So the subnational can be strengthened. And subnational as a different scenario, like geographically it was difficult, some of it, management-wise was difficult. So strengthening subnational can increase our last mile delivery based on that, the recent movement that we have. So that is very strategic move initially. We have to check our outsourcing strategy from the center, which we can manage well to the subnational. Yeah.
Agree. Thank you so much, Alemayehu, Angelina. If you have one last word you want to say, please go ahead. Otherwise, please go ahead, Alemayehu.
Let me start. The strategy that we are going to use following this is, as Dr. Abdul said, actually implementing the center to have movement automatically as a default, strengthen the capacity of the hubs, because we are going to move the whole 61 trucks currently we have as a center to move products to the hub. And also, I mentioned it in my presentation that strategic thinking we started last year when we order actually trucks. We ordered trucks to fit the regional distribution, the small trucks, rather than buying, the lorries, the big lorries. That means we have received them this year. We are going to use them to the hubs, to capacitate the hubs. In addition to that, we are actually in this process, the current task force actually in his plan of action included a strategy, a last mile strategy. That means EPSS strategy. How can we transport products to the last mile delivery? So starting from the center to the last mile delivery, which includes actually port clearance and also the inbound movement of products from the ports to EPSS. Then after that, from EPSS to the regional hubs. Then from the hubs actually to the facility. So we are actually working on the strategy. I think all our stakeholders will participate in the enriching of this strategy, and we will work on that. Then that will guide us to prepare plan of action and also act on the last mile delivery. Over to you.
Thank you. I think the last word and even the last comment is really about last mile, right? Last mile. It's like whatever we're doing, OSTK and other, how do we ensure that we're impacting last mile? Availability, accessibility, affordability. There's a lot of questions around pricing, right? So for us to think of always linking and checking if we're doing better, right, at the UHC level. So I really thank everybody, all the panelists today. Thank you, Ark, Alemayehu, Angelina, Abdulkadir. Thank you, everybody, for participating. And I'm sure you can get the recording thereafter. Nati. Thank you.
Thank you. Thank you very much to everyone.
Thank you. Thank you very much.
Thank you.
Thank you.
Thank you. Bye.